Hello and welcome. I'm Christine Salas. I'm the HTPA Community Director, and I want to welcome you all to our HTPA Healer Development Series to deepen your healing touch practice. Today's topic is on trauma, and we have an amazing panel today of practitioners and instructors to share their knowledge, skills, and expertise with you on working with clients who've experienced trauma. A few things I want to mention before we get started. We are recording this event, and so I ask all our participants to please mute yourselves. And the recording will be available on the HTPA member website. We usually try to get it up within a week of the event. We will save questions for the end, and I will ask you to put your questions into the chat box when we get to that part of the agenda. And we will do our very best to get to as many questions as possible in the time that we have. And I would like to now introduce our lovely panelists. So we have Kathy Allen. Kathy is a board-certified holistic nurse who served as an instructor in the Healing Touch program and on the faculty of Beyond Ordinary Nursing, where she taught integrative imagery to nurses. In addition to Healing Touch, her energy medicine studies have included Rosalind Bruyère's 3-year energy medicine training and the Foundation for Shamanic Studies. Her trauma studies include graduation from the Somatic Experiencing Trauma Institute, where she serves as an assistant in their practitioner training program, the 2-year touch training for psychotherapists, and 2 programs for healing developmental trauma, neuroaffective relational model, and neuroaffective touch. She recently served on the advisory group for the Crisis Stabilization and Safety Aid for Frontline Workers and First Responders at the Somatic Experiencing Trauma Institute. Kathy is a member of the Screen Actors Guild and has appeared in theater and in films. She can honestly say that her talent earned her a prominent spot on the cutting room floor. She also does stand-up comedy. Thank you, Kathy, for being here. We also have Kristi Joy. Kristi is an energy medicine practitioner and instructor with over 20 years of experience in the healing arts and meditation. She has a private energy healing and teaching practice, specializing in helping kids, teens, and adults with regulating the nervous system and having healthier energetic boundaries. Thanks for being here, Kristi. We also have Maria Loebach. Maria is an RN with the Caregiver Support Program at the Portland VA Healthcare System, and she became an HTCP in 2018. She has a unique role of supporting family caregivers of veterans of all eras and is committed to providing holistic and integrative care to both the family caregivers and veterans she serves. Maria brings together her life experiences, education, and various trainings to promote healing and deeper connection in our world. She is a visionary and works in partnership with VA colleagues to bring healing touch not only to family caregivers and veterans, but also to staff. Maria is passionate about providing education and support to promote a culture that values and practices self-care to improve well-being and balance on this planet. Thanks for being here, Maria. And then we have Loree Oberle-Edwards. Loree is a Healing Touch certified practitioner and instructor and a transformational coach and facilitator. She is a skilled and experienced healer with her intuitive awareness and ability to see of the subtle energies of the body. Loree naturally supports clients to deeper levels of wellness, facilitating the release of emotional, physical toxins. Loree helps to provide a safe and supportive environment for healing. Her focus is assisting people in whole body health and leading a stress-free life. Loree has extensive experience in facilitating growth and healing in the spiritual aspects. Loree guides clients to deeper levels of inner communication and consciousness, encouraging those who are seeking a deeper sense of connection with the infinite and greater possibilities for themselves. Welcome, Loree, sorry. And then we have Allison Runchey. Allison Runchey is a Healing Touch certified practitioner with a Master's of Arts degree in Holistic Health Studies from St. Catherine University. She has been providing healing touch sessions with clients who have experienced trauma since 2015, working collaboratively with a mental health practitioner. She has studied the effects of trauma and researched how energy healing practitioners incorporate the principles of trauma-informed care into their practice. She continues to learn from her greatest teachers, her clients. In addition to her healing touch practice, she enjoys Tai Chi and swimming and works as a care guide to support patients at Alina Health in the Minneapolis area. Welcome, Allison. Thanks for being here. So as you can all see, we have an amazing panel here, and I'm really excited to hear what all of them have to share with us today to help us in our practice. I'm going to let them all introduce themselves a little bit more and more specifically about their experience in working with clients with trauma. And I will start with you, Kathy, if you can share a little bit.
Okay, what I'd like to say is a little bit more about my healing touch journey. I got into healing touch in 1992, very long time ago, when it was not accepted. It was considered to be very weird, and we really had a hard time getting it into the hospitals. But I became certified in 93, and I became an instructor in 1995. And in the early days, healing touch just exploded on the scene. We had classes with as many as 40 people in our classes. And the nurses were crazy about it because they could see how it helped their patients. But unfortunately, managed care came in and that kind of gutted everything. And then an article came out in JAMA, the Journal of American Medicine, the American Medical Association. Anyway, they really debunked therapeutic touch, which we used to teach in the Healing Touch program. And that put a big halt on a lot of people's work. And we really were quite discouraged, but we worked through that and came back. And now Healing Touch is in, most all the hospitals or integrative medicine programs everywhere. When I took my first class, since it wasn't really accepted, I had to find a place where I could practice because I knew if I didn't practice right away, I would forget the techniques. And I wanted to get them into my body so much so that I could not think about the techniques, but really follow the energy. And so I volunteered at the AIDS program in San Diego, and the AIDS people, nobody was touching them in those days. And they were so grateful that someone would come and work on them and bring them healing touch. Let's see, what else? So I was lucky enough to study with Rosalind Briere for a while. And I just want to say to those of you who are in communities where you're having a struggle getting healing touch into your community, in San Diego, we would have our support group, and the support group would kind of wax and wane. Sometimes we'd have maybe 20 people there, and other times we'd have like 3 or 2. And I've been to the support group where I was the only one there. And then we were lucky enough to have Lisa and Chris moved to San Diego and started the newsletter for the California area. And then we really grew after that. So my healing touch journey has been incredible. It's totally enriched my life. And I'm just really grateful to be here on this panel with you all.
Thank you, Kathy. And Allison, if you'd like to share a little bit more.
Sure. Hi. Welcome, everyone. I'm Allison, And I have a small practice right now. I offer about 4 sessions a month to clients, something I do in addition to the work that I do with Allina Health. And I've been working with a psychologist who specializes in trauma recovery, and she's also does somatic experiencing. So a lot of my clients have that resource along with me paired together, although we do our separate sessions. And many of the clients that I see have experienced complex trauma, meaning that it occurred over an extended period of time, as well as some specific traumatic events. And several of them also have anxiety, depression, inflammatory conditions, or chronic pain. And so I kind of work, of course, with all those areas with them to support them. And I just want to express my gratitude to the Healing Touch community, and grateful for all of the practitioners and instructors who have led the way that have allowed me to find Healing Touch in 2012, and then eventually become a practitioner certified in 2018 eventually. So I'm grateful to be a part of the group today. Thanks.
Thank you, Allison. And Kristi, would you like to share a little bit more?
Sure, thank you. So I started in Healing Touch. Well, I started off as a massage therapist way back in '94, and I found Healing Touch in '96. I actually worked in the offices right next door to the Healing Touch offices in Lakewood, Colorado. And my boss required all of her massage therapists to take at least level 1 of Healing Touch. So that was one of the best things that happened to me in my life and career. So then I became certified in 2000, and I became an instructor in 2018. I'm a level 1 instructor. And I kind of came to working with clients with trauma through my own healing journey. So I had a chronic illness conglomerate, I kind of call it, where they don't really know exactly what's wrong with you, but the chronic fatigue, and I had Epstein-Barr and all of this for about 5 years. And before that, I had experienced, and during that, chronic stress trauma. And I had also experienced developmental trauma as a child, which I didn't really realize at the time. And I've had some shock trauma. So I've got a little bit of everything in my experience. And so in my own healing journey, which, by the way, energy healing is what helped me the most in recovering. I did all the diets and all the therapies and, things on the physical level, but it was the energy healing that did the biggest jumps, including my training with Jana Mall in her Hara, and that's working with trauma release. But one of the things I discovered in talking with people and then talking with clients is that most people that had, some sort of chronic illness or something that happened, there was something that happened before that in, 6 months to a year before that. And usually, they weren't associating those two things because it was far enough away. So I, began to understand that connection more. And if any of you are familiar with the ACE study, that is, they have found a direct causal link between developmental trauma and chronic illness in adulthood. And that's a resource that I use with clients sometimes. So let's see, I guess that's probably all I want to say. I have a full-time private practice. I see clients in person and remotely. And I teach healing through the vagus nerve with my colleague, Bonnie Thompson. I see some of our students there on the call. And that works a lot with trauma and regulating the nervous system. And I teach some other classes, a sensitive kids class, helping them with anxiety and boundaries. And we have one for teens that we teach as well. So yeah, thank you. And I'm happy to be here.
Thank you, Kristi.
Mm-hmm.
And Maria, would you like to share a little bit?
Sure. Thanks for having me here. I'm excited to share and also learn from everybody as well. Today, I'm going to be speaking directly to my experience working with the veteran population in two different settings that I've worked with them. And a lot of the veterans I see have PTSD, and it might be from combat or in addition to any kind of like childhood trauma or other kinds of traumas. I work with the veterans either in like a clinic setting for 50-minute sessions, and some will come for 1 or 2, and some will return for up to 10 sessions. We also will see family caregivers who often are also experiencing secondary trauma and come with their own backgrounds as well. And the other way I've worked with veterans is at these stand down events. And for those of you who may not be familiar with them, they're pretty incredible. So a stand down event is a community-based outreach event that will provide services and resources for houseless or at risk of becoming houseless veterans. Often they're pretty large events where veterans can come and safely access food, clothing, legal resources, haircuts, mental health resources, just like so many different things, and so many different community members are there. It's really incredible. So I've been able to participate at some of those at like the health and well-being station alongside other Healing Touch students and providers that are also volunteering their time. And it's been pretty incredible to see the impact with these veterans in just short amount of time. So thank you.
Thank you, Maria. And Loree, would you like to share a little bit more?
Yes, thank you, Christine. And I just wanted to say what a pleasure it is being with all of you. I found that through the years of my profession that returning to wholeness and really being able to transmute experiences of trauma for my clients has been a main focus, especially in recent years. So just a little bit about me is that although I haven't had any severe traumatic events in my life, I was very sensitive as a child. So as a result, I met life like a deer in headlights, especially in my earlier years. And as an adult, I have found that these sensitivities that I had are really my greatest gifts, especially in my practice as a Healing Touch practitioner and instructor. So my profession that I had for over 40 years was as a registered dental hygienist. And I specialize in medically compromised patients, especially chronic conditions like autoimmune conditions, cancer patients. And what I found during that time is that I really became interested in the fact that people did respond to medical treatment, and yet I could almost tell after a few visits with them and helping to manage their needs, especially orally, and the side effects of some of the treatments, is that there were ones that appeared to be much more likely to be successful in their path of healing versus those that did not. And a lot of it had to do with attitude. And so I kind of became curious and started asking questions like, have you found, although you may not have wanted this in occurring in your life, have you found any benefits? Have you found change in your life that you're grateful for? And it was really interesting, some of the answers that I received. And it kind of took me on a path of more inquiry. And I actually became a licensed minister because I was seeing a direct connection with the spiritual aspects of physical conditions, and how physical, mental, emotional, and spiritual are really not separate. And that whole idea of the developmental trauma being related to these chronic conditions, especially the ones that I was working with. So that path took me on even a more multi-level path of becoming an instructor with the Chopra Center. I'm a Chopra teacher. I became a Healing Touch certified practitioner with Healing Touch program in 2001 and became a level 1 instructor in 2010. And then I just advanced as a level 2 instructor this year. And I'll tell you a little bit more about that later on. I also feel very grateful for the opportunity of becoming a transformational life coach during the same process, my developing and growing in my healing touch practice. I met dear friend and mentor Debbie Ford and became a certified integrative coach and facilitator in 2002. And through that, over 15 years, we had group practices that we did. We had group processes of very much oriented toward the shadow. And so I became the safety net for these group practices and actually did a lot of healing touch in group setting. And so I'll share a little bit more about that. So this has been kind of this lifelong journey of just feeling very grateful for the changes. Just in recent years, I became transformational coach and facilitator in Feminine Power, founded by Claire Zamet, Dr. Claire Zamet, and then also Dr. Sue Mortar, the Energy Codes with that. And I'll share a little bit more about that. So it's just a pleasure being with you.
Thank you, Loree. So now we'll get to some of our questions. And the first one is, what common intake, assessment, and energetic patterns you find in clients that have experienced trauma? And how about I'll start with you, Allison.
Okay. All right. So in thinking about this question about I was thinking about the intake process. So I'll kind of speak to my approach that I've learned working with clients as they're getting started and through that, like that first session. And really, I've been focusing on general principles to kind of help guide that process, like fostering a sense of safety for them, especially trustworthiness and transparency in how I relate to them, and helping to encourage them to have a sense of empowerment and personal choice as we're going through that process of getting to know each other and starting out. And those are some of what's called a trauma-informed approach, some principles that were developed by, might have heard of SAMHSA, which is the Substance Abuse and Mental Health Services Administration, I think. But Maria, you might be aware of them because I think they're related to the VA. But anyways, there's some principles that I found really helpful to guide. And so I've just kind of learned through time that a lot of the clients I've worked with, they startle quite easily, or, you know, are on high alert for something or someone that might harm them. And with trauma, many things have happened to them that they couldn't control, and they've been hurt. And so I try really carefully to avoid creating any kind of scenario that might trigger that kind of response in a client. And so with that in mind, there's a couple of things that I try to do, especially with like educating them about healing touch. And whenever possible, I send them intake forms ahead of time to let them know that they'll be asked to fill them out and give them the opportunity to do it ahead, as that can be kind of overwhelming all at once. Of course, you know, talking about energy healing and healing touch and making sure they understand kind of what it's about, because many of my clients come and they're like, well, I don't really know. I just thought I'd try it. And so having some clarity around that during the intake process, and especially talking with them about where in the body they feel, or in the energy field they feel, where they feel comfortable with touch or would not feel comfortable. Being really cognizant of that, I've learned has been important. And also I try to help them understand, so when they're on the table, they're not wondering with their eyes closed what's going on, but really feeling nervous inside. So I show them the pendulum and I kind of demonstrate what that looks like ahead of time, as I've had some clients wonder what that is and what I'm kind of doing to them. And I explain why I use it and how I use it. And encouraging them to keep their eyes open, closed, especially to move around during the session if they need to just sort of adjust their position so that they don't have to feel they need to be in that frozen sort of, we think about fight, flight, or freeze, or shut down in trauma response. And I don't want them to get into the freeze or shut down responses there. So encouraging them to, I make sure verbally we talk about this, encouraging them in the intake process to be sure to speak up about any of their needs and move around. Tell me if they need to get up at all at any time. I let them know at the beginning that how I will end the session is through grounding by brushing their legs and usually holding their feet or ankles so that they understand, like they have a signal for knowing when the session is coming to a close. If they're very relaxed and their eyes are closed, then they can kind of know what's to come and what to expect a little bit in that way. And that I, let them know at the beginning that at the end, I'd like to check in for a few minutes at the end, how it went with them. So those are some points that I try to make sure they know before we get started so that they can feel comfortable and at ease during the session, not wondering what I'm doing or why and when it will close. So I try to be careful around that. I found that when talking about the intake forms and that kind of thing, I found that I don't need to know the details or specific content of the trauma to work effectively with them. I focus on their physical or energetic sensations of it, asking them where they feel it in their body rather than trying to find out the details of it. I have a couple of notes here, so you might see me looking down. And in terms of energetic patterns that, I have noticed in some of my clients is that oftentimes it can be either the lower chakras like root or sacral that may appear compromised, or the more upper chakras like crown or brow that appear more compromised. Or sometimes I've noticed that the main chakras are generally flowing, but I'm noticing a lot less energy flow through the arms. That can happen. I've noticed in several of the clients who've experienced trauma from what I've seen in my practice sometimes, or imbalances from left to right. I've also just noticed in terms of energetic patterns that clients will verbally describe a lot of strong energy sensations in their body, especially during the first couple of sessions, and that oftentimes those sensations become more subtle for them over time is what I've also noticed in working with some clients over a couple of several sequences of sessions. So thanks.
Yeah, thank you, Allison. And Kristi, would you like to add to that?
Yeah, that was all great. And, one of the things I love about Healing Touch is a lot of this stuff is kind of built in to our program and our training. So it's just kind of making it explicit, our informed consent, confidentiality, creating a sacred space, making sure clients know what to expect beforehand, giving them choices. Those are all things that create safety, which is important for everybody, but particularly for people with trauma histories. And I would just add to that, and this is also included in our centering and grounding as practitioners. And so from a polyvagal perspective, that's being in ventral, that's being in that safe and social nervous system state. And that's one of the best things we can offer to our clients is that co-regulation. So our nervous systems, so it's going to sound similar to energy, they kind of resonate together. So if we're holding that safe, centered, grounded space, then our client can kind of align with that. And part of that is our facial expressions. So we read a lot subconsciously for our nervous systems through facial expressions, which, with the pandemic, you can imagine with the masks to some extent, that's been causing some difficulty. I have a lot of clients that express more anxiety for many reasons, but that's one of the reasons. We don't get that as much feedback as we're needing. Yes, eye contact, smiling, but not like too intense or too much eye contact, like on Zoom, that can be an issue these days, right? Like Zoom fatigue. You feel like you're on all the time, which can be a little intense and feel not comfortable. So one thing I've noticed, so sometimes I have clients that come in specifically for help with trauma. They know about it. They know it's causing a problem and they want to heal from it. But sometimes people don't really recognize that. And like Allison was saying, it's not necessarily important that you know the details of it. I think, probably just treating everybody as if they have a trauma history is probably the safest bet, right? Because most of us do have some to some extent. But some of the clues just for you as a practitioner are if they don't remember their childhood, that's sometimes a clue that they've had some developmental trauma. If they have a lot of chronic illness issues or just a lot of physical issues, a lot of times that is correlated with a trauma history. And one thing I have found interesting to observe is people's postures. So this kind of speaks to nervous system state again, which when we have a kind of unresolved trauma history, we'll tend to be stuck in that shutdown, as Allison was saying, or the fight, flight, and they kind of have different energies. And so the shutdown is kind of more like that, slumped posture. And I'll see this in myself, when I go into that shutdown, my posture completely changes. And the fight flight energy can be, that more like really upright, straight posture, tense muscles. So I've just found that to be a really good clue. And then as far as assessment, again, going, I look through with my practice, I see everything now through the nervous system. So I'm going to talk about shutdown and freeze again. So when people are more in a shutdown state, which is more common with people with developmental trauma, their system tends to be, so when I assess the chakras, they tend to be kind of all the same. So if there's a compromise, like they're at a diagonal, say, they're pretty much all the same. Whereas with somebody that's more in the sympathetic fight flight, I'll find a lot of variations. So, everything's kind of swinging different ways. And then as far as their field, with shutdown, more often, I will find it more weakened and diffuse. And they'll tend to be, the ones that have trouble with boundaries, energetic boundaries, and taking on other people's stuff more. And when somebody's more in fight flight, it's more like a contraction and tightness, like their field is very in close to their body. And again, I talk about these things because typically if we have unhealed trauma, we're primarily in one of those states. So it's just helpful to recognize that. It was intake assessment. Was there something else, Christine?
Intake assessment and energetic patterns.
Okay, so
yeah, I think you covered it.
I think that's it. I will say the one other thing that I sometimes do that has been helpful sometimes is having clients write a list of kind of their any significant events in their life, like any kind of surgeries, any kind of accidents, any kind of, major losses. And I'll just give you a quick story about that. I had a client coming in for migraines, And I had her do that. And I was looking through kind of a chronological list. And I was looking through it and I said, oh, I see you've had 4 blows to the head. And she was like, oh, yeah, I guess I have 4 head injuries. And she didn't put that together, you know? So that was very enlightening to her. And then just for your information, I did the pain spike and had her kind of participate in that. And she stopped having migraines. So, you know, it's good work. So. Thank you.
Okay, so the next question is probably the #1 question that everyone comes to the call for, which is the specific healing touch techniques that you commonly use with these types of clients, and what your rationale is, why you use those techniques, and why are they more effective than others. And Kathy, would you talk to us about that?
I'd love to. And the good news is that if you don't know anything at all about trauma, if you've had no education in that, you can really help people just using the healing touch techniques. And the first technique I want to talk about is the mind clearing. And that's something we learn in level 1. And the mind clearing, when you put your hand on the back of the head near the occipital ridge, what's behind that? What's in the brain? Actually, that's where the brain stem is located, and that is the seat. That is where our fight flight response is located. So putting your hand there helps to stimulate the parasympathetic so people can relax. And also another position is to put your hand in the back of the occipital area and then also on the forehead. Behind the forehead is where the prefrontal cortex is for the brain. And this is where we do all of our thinking, analyzing, organizing things. And the prefrontal cortex goes offline when you're in a real traumatized position. So just holding your hands there is very, very helpful to help release the any trauma that's stuck. Now, another position where we put our hands is we put our hands on the sides of the head and we send energy there. So it's really at the same level where our limbic system is. And in that area, we have the HPA axis, which is the hippocampus, the pituitary, and the adrenals. And this is the place where the sympathetic response is located. It's a endocrine related response that stimulates us to get moving. So the parasympathetic stimulates us to relax, to be immobile, whereas the sympathetic is to get moving, to protect yourself. Now those two, the sympathetic and the parasympathetic, in trauma get stuck. And the person can get stuck and the person can go into a freeze. So this is helpful for the person to help to start to come out of the freeze. So that's one that's very popular, that for me at least, I use that a lot. And then another technique that I use is the healing touch trauma release technique. This is an amazing technique. And you can learn this after you've done level 3. And the healing touch technique, what it does is what we do is we put the person, we ask them about a trauma that they've had in the past. Now, Janet told us that we need to work with trauma that's not recent, but more in the past. And so what you do, many times people will have symptoms from that trauma and they can't, it's not diagnosable. The doctors can't figure out why they've got that symptom. And so what you do with the healing touch trauma technique, release technique, is, bring up the event that happened to them, remind them of the event, or so they can remind themselves of the event, which is the sympathetic. And then the technique itself, you put them into the parasympathetic where they're totally relaxed. And then as they start to notice any sensations in their body, you can press on that spot and then release the trapped energy through that technique. So I'm just giving you a kind of a general overview of it, because really it's important for you to take the class, because this is just some simple little snippets from that technique. So it's really good to really understand this whole process. Now, when I work with people, what I do is I ask them which side of the table they want me to stand on, because trauma may have happened to them on one side. And if you stand on that side, it may be very activating for them. So I stand on each side, and then they can compare which side feels more comfortable for them, which side makes them feel more safe. Let's see if there's anything else I need to add. So Dr. Robert Scare, who is a trauma expert and wrote the book, The Body Bears the Burden, and also the Trauma Spectrum, said that with trauma, the remnants of the trauma can be stuck in the body like kindling, like when you have a fire and you have some kindling, and that people can go along and not be really bothered by it because it may be so repressed. But with the healing touch trauma technique, when we release that technique, it's like releasing that kindling. And it's much more common that people don't get activated or triggered as easily when you do that technique. Now, if you don't know how to do that, and your client needs more support, any one of the healing touch techniques that we use offer them a sense of safety, a sense of wholeness, connection to themselves, and put them into the parasympathetic, which is so important. So most any of the techniques that we use are very helpful. And then the mind clearing and the trauma release technique are most effective. And also when patients come to me, I'll ask them, what would you like to work on today? Because a lot of, they'll fill out their intake, and I don't want to assume that this is what they ought to do, this is what they ought to have. I let them participate in the process so they can feel like they've got some kind of control. Because with trauma, you lose your feeling of your sense of being in control of yourself. And so anything you can do to help them feel like they're in charge can be very helpful. Thank you.
Thank you, Kathy. And Maria, would you like to share?
All right. Well, as I reflected on this part of it, I think my response that I developed kind of builds on a lot of what everyone's already shared, particularly Allison with the trauma-informed care, and just like Kathy just spoke, ensuring that the person feels like they have a sense of control and safety. And I thought, like, if the person's not feeling safe and comfortable, it doesn't matter what healing touch technique I use. And so for me, when I see a veteran is often, for whatever they're coming in, maybe it's like a last ditch resort to try to deal with pain. It's often anxiety, but they're very hypervigilant when they first come to the session. And so I guess I was just going to speak to a few simple ways that also are similar to what's already been shared here of how I try to create that like safe environment and safe relationship, so to speak. And, I work out of like a medical room, exam room, so they're pretty sterile and not very inviting anyway. So the simple tools that I have access to that I can use is like bringing in a small lamp to even just have some low lighting. However, I will also let them know, because they kind of come in and it's like, whoa, this isn't what I was expecting. I'm like, hey, I've got a lamp on. However, I can totally turn the big light on if you, that would feel more comfortable to you. Same with like having old school CD player, got some music going, and some like it. And I also let them know, hey, some people actually don't prefer to have music. So what would you prefer? Even just when getting them in the room, I ensure that the chair is against a wall. And so that way, when they come in, they sit against the wall and they can see the whole space. That allows them to feel a lot safer and more comfortable. Sometimes I have access to warm blankets, so I can offer them some warm blankets for the session. And that is really comforting and soothing for some of them as well. And then, as like Allison mentioned this too, a big thing is I assure that we have a clear plan of how to arouse them if they do fall asleep or get into that deeply relaxed state, because they will have, it's very likelihood that they'll have a big startle response. And that's scary for them, and it's scary for me. And so often what the plan we come up with is I'm at the foot of the bed, I tap their foot and say their name in a loud, clear voice. And so again, it's just things that we've already heard, right? Just ensuring that they feel safe, that they're in control. I remind them that they're in control of the session. And when they, at any point in the session, again, we kind of create this clear plan or agreement ahead of time. Like if you want me to stop at any time for any reason, no questions asked, you can either just raise your hand and I'll know that means stop, or simply say stop and we'll stop. And by that point, I can already see sort of the calming down just in the chair. And so I too really have found the mind clearing to be really effective. And so I will start off most of my sessions with the mind clearing. And that allows me to really kind of monitor their response. And for most of them, it's amazing how quickly they are able to get into that, activate that relaxation response. And then from there, I'm often simply just doing one of the full body techniques, whether it's the chakra connection or spiral meditation. And then lastly, at a stand down, that's a completely different environment. And we're seeing a lot of people, it's kind of chaotic. So we really just agree that we're all going to do a 10-minute chakra connection. Sometimes it's just one-on-one, or sometimes there's two of us with one veteran. And that has been very effective. So thank you.
Thank you. And Loree, I'm going to let Loree, and then Kristi, you wanted to add something after that. Great. So Loree, if you want to share.
Yes, thank you. I love the synchronicity and the attunement with all of us, because I too am so grateful for a 10-step healing touch sequence, because it really is about the preparation, not only for us to be really clear on what the needs are of our client, having them be co-partners and co-creators in their healing process, is also to be prepared as a practitioner. And I usually use the Hara alignment meditation, and then through Dr. Sue Morter, I learned central channel breath, which is really quite helpful, not only for me. I really found a difference between grounding and embodiment, and really being able to really be present on a deeper level. And it's a practice that I can teach to my clients too. So that's been very useful. As far as the intake is concerned, we have such a thorough healing touch program intake form. And so I do use that. And yet through my other studies and work with clients, especially in coaching, I have a client profile and objectives, which kind of addresses some of the things that we've already talked about, looking for deeper patterns and being able to support the client in really understanding what their strengths are, to really amplify that, as well as some of the barriers in their life that might have repetitions through the years, and also really keying into their deepest desires and creating mutual intentions. So again, it's really a co-partnership that we create together, and that really safe environment to let the client know that they are in charge, that they can follow their breath as far as pacing themselves, as well as being able to be able to have that power to state what their needs are during the process. So being really gentle, being aware of the physical, like facial expressions and the physical appearance of their body during the practice, And sometimes what I found is, and not always, that when there's been a lot of trauma, sometimes a client will go into the shakes, and it can be embarrassing for them. And what I found is that is some of the most beautiful openings as far as transmutation of the energy, if they're allowed to see that it's normal. It's a process that we experience in that trauma response of being able to shake off the energy that's so intense when they're activated. And if we just allow them to breathe into it and allow it to just unfold naturally, it's, as I said, just a beautiful process. Some of the techniques that I do, well, one is that I usually, because of either supporting clients with chronic conditions, physical conditions, as well as knowing a history of trauma, I usually ask for a commitment of at least 6 sessions a week apart. And so what I found is a progression of really beginning with full body techniques. One is like going through the levels. Level 1, since they're not as familiar with me, of starting with chakra connection, and which connects open and balances the flow of energy in the body and really allows the physical, mental, emotional, and spiritual aspects of that manifestation to be cleared. And then also the ability to teach the client the self-chakra connection, again, to allow them to have the power to support themselves in their self-care. I do use magnetic clearing that facilitates relaxation, releasing any pain or physical or emotional toxins or congestion from the energy field. In uses related to trauma, it helps to clear chronic pain, that history of trauma, emotional clearing, and even insomnia can be a manifestation of people with a lot of history of trauma, of having a high mental activity and rumination. So I also use the mind clearing a lot for these clients in order to support that clearance of stress and relaxation, and also balancing the right and left hemispheres of the brain. And Kathy so beautifully explained kind of the processes of each of those steps. And she's been a great mentor for me. So as far as level 2 techniques, I would say it's probably one of my favorite levels of healing touch right now. And the reason why I went into advancement as a level 2 instructor, because of being a transformational coach, I really saw the benefits of being able to support clients in that guidance of looking into memories of past trauma. And so the spiral meditation, as far as connecting, opening, and balancing, expanding the energy system first, to have a deeper healing, especially when the client is feeling stuck or anxious, feeling imbalanced, or feeling fearful, to be able to really help to open that up for them so that they are much more open to the healing process, the healing, the chakra connection with the body-centered interview is just such a expansive technique in order to be able to support the clients in seeing some of the patterns that come up. And I do ask specific questions, like asking them whether they have any memory of any past events, any traumatic events, or emotions that relate to the specific areas that I am addressing along the chakra connection, and has revealed so many things for the client in a way that, besides asking for the areas, of being able to ask what that area needs and asking them to use their breath to breathe into those areas. And so I too agree that sometimes it's not a matter of really focusing on the event itself as much as the physical sensations, the feelings in the body, and to be able to speak to the more somatic levels and ask what that part of them needs, rather than going deep into the events or situations that may have caused the trauma and reactivate them. So it's a really gentle process of asking what that part of them needs and just asking if there's any insights or wisdom or messages that come from that experience. So it's transmuting the experience from one of trauma to be able to see, sometimes we see the gifts or the wisdom in that event in their life. Like I spoke earlier about some of the cancer patients, the chronic patients that I had in my dental practice. Some of the back techniques can be useful just because a lot of stress has held in the back, and also just the channels of the sympathetic and parasympathetic nervous system follows the whole structure, especially around the core or the spine, as well as our energy centers are located there. So I found that sometimes key disturbances would be in the root or solar plexus area. And I've also done some level 3, and yet I've found that the more I raise my vibration and embody more of my true self, that essential self that we are, the more that I use just pretty simple techniques and do more inquiry with the client. And then I'm able to teach them the self-care practices that they can do on themselves. We want to empower them rather than having them get dependent on having to have, even though healing touch is so beautiful, process for all of us to be have that support from somebody else as well. So it's kind of like that tuning fork of being able to attune and resonate with the client begins to resonate with our high vibrations. So most of these techniques, even level 1 techniques, can be on that higher expansive level. So that's it for now.
Thank you, Loree. And Kristi, did you want to add something to this question?
Yes, thank you. And actually, one of the things I was going to mention was the body-centered interview. So yeah, that was a lovely explanation of how that works with trauma. And, you know, kind of what Kathy was saying too, like, even if you don't know a specific trauma release technique, everything that we do is helping them get to that ventral, that safe, relaxed, parasympathetic space. And that is healing from trauma. So one of the things that I try to make explicit for clients is this way you feel right now, which, you know, most of the time at the end of a healing touch session, people feel better, right? They feel more relaxed, more connected, more at peace, safer. That's where we want to help them to get to more and more often. So, you know, these other states, these survival states, they have their place, right? They're necessary. They help us survive. But the problem is when we get stuck there and we can't move back. I mean, some people are stuck in these survival states most of their lives, and they're not even familiar with it. It's like the pathway isn't there. So that's one of the things that's so valuable in the work that we do is it's making that pathway. And it's like, okay, this is where we want to help you to get to more and more often for longer periods of time and more easily. And that is healing from trauma. So that's all.
Great, thank you. And
I'd like to add to that with the body-centered interview that we learn in level 2. It used to be called the trauma interview, and it was too traumatizing for the students when we went through each position, and the person would reveal what trauma they had at that time. So another way of doing that is to, before you get started, is to tell the person that, or the client, that you're going to be asking them these questions about if they've had any injuries or traumas to this particular area, and that remind them that when you have your hands over that area, you are sending healing energy into that area. So it's not just, we're not just asking questions, we're doing healing at the same time that we're asking those questions. And also, another thing that you can do is to tell them or ask them to, when they tell you about the injury or the trauma that they had in that area, ask them to think about what was it that helped them make it through? What was them? What resource did they have? Was it an internal kind of thing that they had, their own internal strength? Or was there somebody or an animal even that helped them make it through this time? And let's see, it was an animal. I was going to say something else. And to ask them, when did they know that they were safe? When did they first know that everything was going to be all right? Was it after they saw the doctor? Was it, just when was it? So that gives them something positive to think about as you're going through this whole interview with them. That's all. Thanks.
Thank you. And Loree, did you want to add to that?
Yes, I just wanted to add a little bit more as far as the breath is concerned, because with the central channel breath and asking the client during the chakra connection and body-centered interview of asking them to breathe into that area, bringing it into their central channel or their hara alignment, as we often use, it allows them to get more embodied when very often as a history of trauma, there's a tendency to check out and just kind of leave. And so this brings more connection so that we can heal the area and have more connection. And that's why the chakra connection is so great, because it does connect, open, and balance all the energy centers. And so this empowers a client, and it's kind of counterintuitive very often for the client. And yet when they experience it, it can be night and day. So it really adds clarity to their process from then on.
So Loree, I'm so glad you brought that up, as far as people can be dissociated and out in the ethers, not really embodied. And for many people, that's a resource. That's what helped them get through a terrible traumatic experience. And so as far as people becoming more embodied, that's a process. And the more they feel safe, when they feel safe, then they start to come back in. But I've had talked to other practitioners who said, well, we just need to get them in their body. And I thought, no. We need to set up the circumstances. We need to set up the ability to feel safe that allows them to come back into their body without putting any pressure on them. So thanks for bringing that up, Loree.
Thank you. Very good points. Kathy, I'm going to let you continue here to our next question, which is about how often and how long you're typically seeing a client who has experienced trauma, how many sessions, the duration of the sessions. Could you tell us a little about that?
Well, wouldn't it be nice if we had a model or blueprint to follow that tells us exactly how many times you need to see this person, how long your session should be, and all of that. But that's kind of like baking a cake where you have all of the recipe and this is what you have to do. People are different. Everybody is different. Some people come with very simple traumas. They may have had a car accident. I saw Janet work with someone and when she was teaching us how to do the trauma release technique, the person had had an accident and she'd had pain ever since then. Janet worked with her. It relieved the symptoms that she was having and she never had to come back. But that's for like one event. Many people will present with multiple traumas, like Kristi Joy, you were talking about a complex trauma where people have multiple traumatic experiences, and also they may have developmental trauma. So with those people, you have to assess them each time they come to see you about how they're doing. Now, if you when I work with people who've had trauma, I usually have them come back another time so we can assess the effectiveness of the treatment that they just had, and if they're going to need to have continuing sessions. Now, patients or clients want to know, well, how much is this going to cost? How many times do I have to come? So what I tell them is that it would be nice if you only had to come once, but why don't we plan on you coming at least maybe 2 or 3 times, and then we'll reevaluate how many times you have to come. We'll reevaluate how your body and mind are responding to the treatment. So sometimes it goes on for a long time. Now, I don't schedule patients every hour on the hour, because I know that they're not always going to be coming out of that altered state within that time frame. So I would schedule patients about every hour and a half to give the, I'm sorry, I'm saying patients, I'm a nurse. I'm so used to saying that instead of clients. So I apologize to you. I schedule clients so that there's time in between each client in case one client needs to have more time coming out of that altered state. So with people who are thrown by life's experiences, then you just keep offering them healing touch as often as they want to come. I had a client that came that just loved coming. This was the only time that he had to really be focused on and to really think about himself. I had another client that came. It was an older woman. She was in her 80s, I think. And she had trauma. We did the work, and she wanted to come another time. And she came. And what she wanted out of that session was she wanted me to sing to her. It was so sweet. It was just so sweet. It felt so nurturing for her. And when I saw how she responded to that, it was nurturing for me too. I loved it. So you just have to, or just to reiterate, you just have to see how the person is responding to the treatment. Now, I know that some of my other practitioners here are going to be talking about plans. And so be aware that when you work with someone, that you want to give them a plan of action that they can do to help to retain the healing that they've just got. But the first plan that I have is I don't let them just get off the table after they've had a session. I have them stay there for a while so that they can integrate that energy. Because if they get off the table right away and go off and with their daily task and what they have to do, what they're doing is that they're expending that energy that should be going for their healing. So you keep them on the table for a little bit longer. And then I know my other practitioners here will give you some ideas for plan of action.
Great, thank you. So our next question is about common practitioner observations and evaluations. And Kristi, would you talk a little bit about that?
Sure. So I guess I've been thinking about this question. I think just, the things that we're normally paying attention to with clients as far as their breathing rate, their, that flush that they get, the eye movements, if their eyes seem really tight or if they're, relaxing and their breath is deepening. I really try to make it known to clients that they can always speak up if something is uncomfortable. Sometimes, and I think it's been mentioned already, when people are going through a healing process, it was Loree was mentioning the shaking, right? So sometimes what can happen is as that fight flight energy is being released, they can have some discomfort, some sensation. Sometimes it's the shaking, sometimes it's agitation or just feeling uncomfortable. So just, being aware that that can happen, and that's a normal part of the process. If somebody is in a shutdown state, the pathway back to ventral is actually through fight flight. And that might be very quick like that, or it might be longer where they do experience some discomfort. Or, sometimes people can feel really spacey and get more dissociated. We were talking about, getting them in their body and, not being like aggressive about that, because it's not going to feel comfortable for people sometimes. So being very gentle with that. And sometimes when somebody starts to come into their body, they can begin having some discomfort and some feelings come up. So just being aware of all of that. And I guess the other thing that I might have already mentioned is kind of at the end of the session, assuming that they are in that, very relaxed, peaceful, connected state, giving them some time to let that integrate and bring awareness to it, noticing how you're feeling in your body right now, and, holding that intention to carry that with you and knowing you can access that whenever you want to. So I think that's all on that.
Thank you. And next is about the client's feedback. And Maria, would you talk to us a little bit about what you find with client feedback?
Sure. So I'll speak first to the stand down events. Like I said, we were just doing 10-minute chakra connections, and I want you to keep in mind that we're also doing this in spaces that were like loud, overstimulating. It'd be activating for a lot of people, but imagine if you're someone with a history of trauma in this environment. So people would sit down and be rating their stress anxiety at an 8 to 10, and even like off the charts for it. And by the end, it would be reported at like 4 or less. Some people even were down to 0. And we would always be mind blown, like, oh my God, like in 10 minutes, this is how powerful this was. And they're still in this like crazy loud environment. So, and often the folks that were brave enough to come and have these healing touch experiences were quite surprised themselves and pleasantly surprised. It allowed them to feel much more comfortable about continuing through the event and being out among all these people. So it's pretty cool. And then in the sessions, like these 50-minute sessions with veterans, again, these were mostly men, some women that are coming, never having an experience. Maybe some have heard of like Reiki, but never experienced it, and just really very, very skeptical. But there because maybe a provider encouraged them to at least try it, or just kind of desperate, almost like just a last-ditch effort to try something to help find some relief. And again, I would always be amazed that after one session, many of them reported feeling really relaxed, almost asleep, which surprised so many of them because many of them don't sleep much, unfortunately. But just that sense of ease and feeling at peace by the end of it, they were shocked. And they would often be like, wait, what? How did this happen? What did you do? And so it just really was very sweet and encouraging to see. And so, brought a lot of them back. I'd be surprised at some of them that returned for a few more sessions. But overall, I think it was just, for my experience with this specific population, just being able to see how impactful it was in just like one session or 10 minutes. It was pretty powerful.
Thank you for sharing that. And Loree, what do you want to add to that?
Yes, thank you, Maria. I've also done stand down, and I have the same experience. It's just so amazing in such a short amount of time, and the gratitude and just expression of thanks for that small contribution that we make, and it's so powerful. And I really feel sometimes in these group settings, that background noise becomes a white noise for them, wherein actually it can broaden the field of safety. So it's interesting because I found the same experience in the shadow process that I shared earlier about, and this group of like 80 to 125 people in this room where things are going on, and yet being able to have a safe space in the corner doing chakra connection and magnetic clearing and having these amazing results. So safety is a key factor, and just we've mentioned it several times, just normalizing some of the effects that people will have, like the shakes and everything, and let them know that energy is being transmuted, that there is healing in the process, that we're holding the energy of healing open to the universal field of energy. Energy is neither bad or good, that everything is energy, that the client always controls our outcome, to follow the breath and to use the self-care practices. And just to emphasize about the central channel breath that I was taught by Dr. Sue Morter, there are 4 anchor points. One is at the root called Mula Bandha, the first chakra. The other is at the heart, and just bringing the shoulder blades back and down. The throat is another key energy center of constricting the back of the throat, like Darth Vader breath, so they can actually hear their breath coming through. And then rolling the eyes back allows that pineal gland and just the tension in the pituitary area to help to transmute that trauma. So by squeezing those areas as they bring their breath through the central channel, and then if they notice some tension or tightness in a certain area, to imagine bringing that into the central channel. Because our purpose in life is to, as spirit, is to descend down into and connect to the earth. Our energy field actually extends down at least 2 feet down below into the earth. It's that chakra 10. And so we literally are implanted in the earth. And then our ascension is really being able to embody more of our spiritual self within the body and just experience humanity. So it's our spirit is having a human experience. Our body is our action. And very often the hands and the arms become activated because that is our chakra 11. It's our experience, the really kinetic energy that helps us to transmute any energy and expand our field into wholeness. So let's see what else I have. Just letting them know too in that process that when they're ready to release, they will. So knowing that they are empowering themselves. And I've often found profound shifts in just one session. So just clients will remark on how much more grounded, centered, and balanced they feel, making statements like, I feel so much lighter. I feel like a heavy weight has been taken off of me. I see everything from a new light. So that's changing their perspectives or insights, inner wisdom. I feel I am no longer alone. Sometimes there's feelings of isolation or lack of control. And just being able to let them know that that shift from not having to feel like they have to check out, that they have the control to be more in their body. That's it. Thanks.
Okay, thank you. So next is about the kind of self-care plans and referrals, follow-ups. And Kristi, would you talk a little bit about the common ones? And I know we've kind of talked a little bit about that with giving people the self-chakra connection, but please add to that.
Yeah. So a couple of things I want to say. One, as far as future appointments, yeah, sometimes people do want to know, how many times am I going to need to come? And like Kathy said, it's like, that's hard to predict, right? It depends on what's been going on with them, what their level of participation is in their healing process, what other current life circumstances they have going on, current stressors. A lot of times these days, I don't I kind of leave it up to them, or I let them lead that. I usually will end by saying, would you like to schedule another appointment now? Or would you like to see kind of how this process is for you and let me know? And that kind of puts the responsibility on them. Whereas I feel like sometimes when I say, you should come in for, I think, you need this many sessions, then it puts more of the responsibility in their mind on me. And I want them to be, taking responsibility for their own healing. And, I certainly will recommend at least a follow-up session for people, and then kind of reevaluate. And then the other thing that I do is kind of asking them, how can you feel more safe and connected and joyful, creative in your life? Kind of helping them identify the things in their life that maybe they're doing, or maybe they used to do, that can bring more of that ventral, safe, connected state into their life. So, the more they can do that between sessions, because even if they see us once a week, that's just that 1 hour, and however long it lasts after, it's what they do in between that's going to have the most effect for them. And then, we've talked about, kind of being in touch with our bodies and the sensations in the body, and encouraging people to be for themselves what I would call an empathetic witness. So that's what we are as practitioners for our clients, right? When they're with us and we're listening to them, and we're present with their experience and their feelings, but they can be that for themselves also. So when feelings come up, when anxiety or anger or fear or sadness or, pain in the body or whatever it is, holding some space around that for them to just be present, like you would, I will often describe it as you would a little child, right? Like you wouldn't tell a little child, God, you're being ridiculous. Why are you feeling that way? Get it together. You would be present with them. And so I, encourage clients to be that for themselves. And then, with referrals, if somebody has not already, been in counseling or is currently in counseling with a trauma history, I will usually, recommend that, kind of depending. Some people have come in and they've done tons of therapy, and now they're looking for, more healing on that energetic level. But definitely making sure that they have that support that they need. Yeah, I think that was all I had on that. Thank you.
Thank you. And Allison, would you like to add to that?
Sure. Yeah, I can definitely, I would agree with everything that Kristi Joy was saying, and would just kind of piggyback on that a little bit here to say that before offering, any suggestions or ideas about next steps or plans, I try to encourage that sense of self-empowerment in them, asking them, what do you feel like would help you continue the healing from today's session? And seeing what they identify, and kind of then drawing from that to talk about potential plans or self-care things they can do. Often I find that when clients make that transition from maybe being on the table to sitting up and getting ready to go about their day, they may still feel a little bit like, spacey or something in that. And so helping them learn how to ground themselves as part of the plan, I've found to be helpful. As simple as tapping the feet on the floor while they're sitting there while we're talking to wrap up, or using the imagery of a tree, brushing their own legs and holding their own feet toward the end to help themselves ground. I may give them some information about the chakras verbally, or sometimes refer them to some resources in writing about energy healing or about the chakra system. And I try to do that with an approach not to get too analytical into it, so that they don't get into overanalyzing that aspect of things, but building some awareness in general about that. And I ask, if they'd like to learn some additional self-care practices, and if they do that, I may start with something very, very simple, like, feeling the energy between their hands and then placing it at a place that may feel discomfort at some point, or at their heart when they're feeling an emotion or something like that. And then over time, building on that to maybe teaching them eventually, like self-chakra connection over time after we've tried a couple of small ones. And then doing that. So those are some thoughts I had about the plans.
Great.
Thanks.
Great. Great. So now just some success stories that a few of you said you could share with us. And Loree, would you share with us?
Great. I was just about to add something as far as the plan is concerned. I often, especially with the chakra connection and body-centered interview, in the process of them being deep in the healing process, ask them for a next step or action in order to really amplify the transitions that are occurring, and also to be able to more fully integrate that part of them within their bodies. So I find that because it's on a more somatic subconscious level, it very often can be anchored in deeper rather than coming from mental level. And I appreciate what Kristi and Allison said, more on that level of speaking to them in more of those terms of what their needs are on a deeper level. So thank you. As far as success stories, Healing Touch is just so great, and it's so gentle and heart-centered that there's so many successes, and everyone improves, I've found. And as we've talked about, trauma is something that we all have had on one level or another, some more than others. Some of the more profound successes that I had was reports like I feel more progress in a few sessions compared to the last 5 having 4 years of therapy. And so in the group setting, I have had several profound experiences. One that I remember so clearly because it was so profound is that as I was guiding this client in a group process to follow an inner meditation and reveal inner blocks, I was doing the chakra connection with body-centered interview. And after the process, the participant commented that she'd had chronic lower pain for over 30 years. And as I was connecting, opening, and balancing at the hips, she recalled her father using a belt on her in that area. She had no memory of this prior to the chakra connection in this process. And when she when the process finished, she had no pain after the healing. And I checked with her several times afterwards, and she continued to be pain-free. So she was so grateful, and really found that the guidance, insights, and wisdom and empowerment that she received just by that one session. So that was a really profound instance. And yet I've had so many that are very close to that in the same process. And even though I've recommended very often to have successions, it doesn't need to be successions. And yet Healing Touch is just such a great balancing of having self-care and being able to continue the process of growth and expansion, which we never end. So thank you.
Amazing story. Thank you for sharing that. I know we're getting close to the end of our time, when we might be going over for anyone that still wants to stick around. Kathy, did you want to share a success story?
Sure, I have a couple of success stories. One is when I was a new level 2 Healing Touch instructor, and I was teaching a level 2 class. On the way to class, I was praying because I was so exhausted. And I kept saying, please give me the energy to be able to teach a really good class. So I go to the class and I'm teaching the back technique. And one of the people in the class was my demo. And I didn't know this, she was in a wheelchair, which I could see that, but she was also on continuous morphine drip for her pain, for her back pain. I didn't know that part. So I did the back technique, and as I pulled my hands out off the back, one of the students saw like a spike come out of her back. And the student had an incredible response and was pain-free for the next 48 hours. And then her pain came back, and I didn't work with her, but she worked with her doctors. But that was amazing that she had that kind of response just from the back technique. It wasn't even a technique designed to work with post-traumatic stress. So we had that. Then I had another patient who had breast cancer, and she had surgery and she was doing well. And so this is a case where you need to be prepared for anything that can happen. You never know what can happen. And so as I was working on her, she went into a trauma response, and she shared she'd been in a car accident where she was hit on that same side of the body where I was standing. And so we did some work on that, and she went from wanting to have a treatment because of her breast cancer to healing her car accident. And that led to her birth experience, where she was pulled out with forceps. So it was just an amazing, amazing experience for her. And then one other case I'll just share, that my neighbor was traveling teaching classes, and on her way back home, before they landed, the pilot told them to prepare for a crash landing. And she looked out the window and she could see all the fire trucks there, and they were sure that this was going to be the end. So they didn't crash. But when she came to my house to tell me about it, she says, I have to fly someplace next week, and I don't think I can do it. So I did the trauma release technique on her, even though Janet had recommended that we do it on people who've had a traumatic experience in the past. This person's trauma was that very same day. So I adjusted the trauma release technique and did not go into the questions about all of the trauma, because it was right there in her body. And so we did the trauma release technique. And during the trauma release technique, she kept saying, I feel like running away from the plane. I just feel like running. So I told her, see yourself doing that. Just see yourself running away. So she did that. After the treatment, she said she felt so much better, and she was able to fly to the next weekend to go to another place to teach another class that she was teaching. So that was another success.
Thank you. Wonderful, amazing success stories. And then finally, challenges and anything else that you want to share. So Kathy, if you want to share a little bit about any challenges that you faced.
Well, first of all, what I'll say is always stay within your scope of practice, because people will come in with these sometimes situations that you're really not qualified to handle, to take care of. And so stay within your scope of practice and have a list of referrals that you can refer people to. Now, there are many therapists maybe in your community, and also there are many programs that deal with teaching people how to work with trauma. And many times what they'll have is practitioners all over the country who are on their website that people can go to and choose to work with one of those practitioners. and also I'm aware of all kinds of other kinds of therapies that I can refer people to. So that's good to have that kind of a list. Now, one of the challenges is for you yourself to stay grounded, because sometimes hearing some people's trauma can be very upsetting for us. And so keep yourself grounded and do your own personal work. I had a patient that came in one time, a client that came in one time, and I had worked with her once before and everything went really well with doing healing touch. And she came in for another session and she said she was suicidal. So I said to her, do you have a plan? And she said, yes. So that is really something to be very, very, to be dealt with right there in the moment, because if a person has a plan, then that's another level of risk, a high risk situation. So I said, have you done anything other than coming to me to work with your trauma, to help yourself? And she said she'd been going to the county mental health, but they kind of don't really respond to her. They weren't really helping her that much. So I said, we're going to go there right now, and I'm going to stay with you until they see you and give you what you need. So we went to the county mental health, and I stayed with her, and I told the people up there that I was going to stay with her until till she was treated. And so they gave her the attention that she needed. But that was a big challenge to have somebody come into your office and say, yes, I have a plan and I'm actively suicidal. And luckily, the county mental health wasn't that far away. But if I hadn't done that, another option would be to say, this is a really good time for you to get more help, and we need to call somebody, either a family member, a friend, to take you to get more help. Or if the situation is really bad, then you want to call the authorities to come and take this person and maybe put them on a 24-hour hold, where they can be treated in a facility. So it all depends upon what the person presents with. Mostly you're not going to have that kind of an experience, but I just want to share with you that it could be possible. It's very rare, but it could be possible. Now, another thing to watch for is transference. And transference is when your client tells you about their situation, and it activates you and your situation, and things get kind of cloudy. And you feel like that it's your job now to take on this person's process. And it's not your job to take on this person's process. It's your job to help this person deal with their process themselves so they can have the healing that they need. So you have to watch out for transference. And then I just want to say that with trauma, sometimes the adrenals are working overtime. So what you can do with that is warm the adrenals, either with a heating pad, which I don't really like to use because the electricity isn't good for your field. So I use these little bags that I have that are filled with, what are they filled with? Not rice, flaxseed, that's it. So I warm them up a little bit in the, and I tell the client to do this too, warm them up a little bit in the microwave and then put them on your adrenals to soothe the adrenals. And I would like to say that, Kristi, I'm really grateful to you for sharing what you shared, because I too have a complex PTSD and developmental PTSD. And it seemed like I'd heal one thing and then something else would come up. So when I was healing myself from my own PTSD, I decided to not do any healing touch because there was so much trauma in my field. I did not want that to be my patients to attune with my field, because that would not have been helpful for them. So I had to pull back it was been years I pulled back from doing healing touch. And then I worked on my own traumas, and you study what you need. And so I really studied in a lot of trauma healing classes. So I'm telling you all this to normalize it. And I know we've all talked about, we all have trauma. Some of us have a little bit, some of us have a lot more, but there are so many resources out there for that healing to take place. And the beauty about it is that once you heal yourself from you've healed from your traumas, you can hold space for your clients in a much deeper way. So that's all I have to say about that. Thanks.
Thank you, Kathy. Such great, important points that you made. And Allison, any challenges or anything else you want to share?
Yeah, well, I would echo many of the points Kathy just made. Were actually some that I was going to share too. About secondary trauma, for example, which is, listening to and being present for many of the experiences and being in the field with an individual who has experienced a lot of trauma can be disturbing, for myself and for us as practitioners. And as I heard another practitioner once say, it's as if we're accessing a widespread field of trauma within the human experience when we do this kind of work. And so the self-care and making sure that I'm taking care of myself and my own issues that may be present in my life experience is important. Taking extra time to clear and balance my field and receiving healing touch myself as a client, getting on the table myself. And then staying, again, Kathy mentioned this, the staying within my scope of practice can be a challenge if someone is very verbal and wanting to describe and go into the emotions verbally about their past experience. And whereas I'm not a therapist. And so there will be issues that I'm not able, that's not in my scope to address. And yet at the same time, if someone is talking, I can't lack the compassion to be a witness to that at the same time. So I found that it's this fine line of that if they're forthcoming, to simply listen and hold the space, as I heard someone say, hold space, and gently encourage them to follow up with a therapist they may already be working with, or someone who could be a resource to help them through that. And then also, I have found that because a challenge is that because clients may have learned to ignore or override the signals that their body has been telling them for many years, they've learned to just shut that down and not respond and not really even acknowledge what their body is telling them, is that sometimes they don't feel able or even aware of when they're feeling uncomfortable. And it can be especially hard for them to speak up. And I may even ask them, is this all right if I put my hands on your head? And they may say yes, but they may feel no. And so it's a fine line to kind of gauge that if I'm getting a sense of this may be uncomfortable for the patient or person, client. That can be tricky. And I found it's important to, keep checking in with them about this at the beginning of each session and during it, as I'm moving through the session, as their comfort level may change. And, for example, one client I worked with was comfortable with touch at the hands and the feet, and in the other areas of the body was all off the body. And eventually over time, she became more comfortable for touch at the legs and eventually in the torso and eventually even around the head, which was her most sensitive area. So that's been a challenge just because the clients, they're not doing anything wrong. They just simply have learned to shut down their sense of feeling discomfort. And then also just to say that, what I think I mentioned this toward the beginning, but something that I've found really grateful or helpful, and I'm grateful to have found are, this group of kind of guiding principles called the trauma-informed approach that can be used for interacting in a supportive way with anyone who's experienced trauma, which is many, many people. And whether they're a Healing Touch client or a friend or family of mine. And that, a couple of years ago, a colleague of mine, Dawn Ebeling, and I interviewed several energy healing practitioners about how they use these principles in their practice. And so I learned a lot from them as well. And I'll just put a little link in the chat about that for anybody who wants to learn more.
Great, thank you so much. So we are over by 15 minutes already. I appreciate all our panelists staying with us. So I'm sorry, we're not going to have time for questions, but I will say that all of our lovely panelists today are open to you reaching out to them directly. You can find their contact information in the practitioner directory. And then some of them are also putting their contact information in the chat as well. So please feel free to reach out to them. Thank you so much for participating in today's event. And a very special thank you to Kathy, Allison, Kristi, Maria, and Loree for sharing their wisdom. As we can see, we went over our time because of how much information they were able to share with us that is just so valuable and useful to all of us in our practice. So thank you so much for volunteering your time and sharing your knowledge with us. If you have any feedback about this event, feel free to email me. I will put my email in the chat. Then I know some of you probably need to go, so feel free to go as I'm closing here, but I'm going to be putting my email in the chat. The next Healer Development Series topic is end of life, and that'll be January 7th, and that'll be at 12:30 Central as well. I will send an email about that. And then finally, if you are a certified practitioner or instructor and would be interested in being a panelist for a future Healer Development Series topic, please feel free to email me and reach out. Thank you again for being a part of our event today, and thank you for all the healing you bring to the world.